Om Shri Sai Ram. My humble pranams at lotus feet of Swami. All the dignitaries, respected elders, my dear sisters and brothers. I'm Dr. Sangram, working in Obstetrics and Gynaecology department of Sarla Hospital since last 6 months. And before 6 months back, that's when my life got changed. When I stepped my feet in this holy land of Muddenahalli, it has been a really pleasant surprise for me. Life has been really pleasant for me since then. Might be some last birth punyas that I have done, that I have got an opportunity to be undue grace of Swami. So a month back, one day I was just walking in the ward when I got to know that Swami wants to send us to Fiji and experience some clinical practices and get connected to the worldwide mission of healthcare that our institute is working on. So we are firstly, I'm very thankful for sending us there and giving us this golden opportunity to learn things and get connected to all the other institutes over the world. So my friends and I, initially we had this first thing that we are getting a break after 6 months of long continuous work of post graduation, and we are going. But at the same time, we were not even 1% aware of how this journey can change us from within. Finally, when we went to the beautiful island of Fiji, and we met Arvindanna, and he told us how the Sai Sanjeevani Children's Hospital was built there when Swami stepped into Fiji for the first time. And among few people, when he told them that his idea of building an international standard pediatric cardiac center on the island of Fiji, it was a mind-boggling idea. And no, not a single person of was hearing that was believing the idea of the Swami. They were like, it's just impossible because those were just human minds. But our Swami, he can make anything possible. And he did it. And we have seen it with our own eyes. Then I was very curious that why Fiji? I mean, why Fiji? There were so many, the world is so big, and why not any other country? So when I was just working in the OPD, pediatric OPD, and every child who was coming to the OPD, they were bringing one chitti with them, and with the injection penicillin was written. So I got to know that the prevalence of cardiac anomalies, cardiac heart diseases in Fiji is literally 5%, which is very tremendously high. Than India, it's just 1%. And that's why he chose that specific place in the South Pacific region to serve the children over there. And that was his vision, that was his mission. And that's when we realized that's how he works. There is so much thought process, there is so much things and behind his every thought. And one more thing that amazed me while working there, that the idea of Swami, that the Sarkar, Samaj, and Sanstha, 3S model, how they should work together to make the difference in the people's life, to make the society a better place to live, that we can see there. All the people, the government, the Sai Sanjeevani Hospital, and the people of Fiji are working together to save these tiny hearts, to heal these tiny hearts. And when I was just working in one day, I was just working in the step down ICU. There was a mother and there was a child, maybe a month or 1 year, 1 year old. And the child, she was just post surgery, and the mother was crying. I was just curious. Then I went to her and I asked her that why she was crying. I was just curious. Then she said, actually, she didn't had words to say thank you to the institution, to all the doctors, nurses, and the hospital staff working there. And they were just working there to ensure every child coming with the cardiac disease there goes back to the home with a big smile on the face, and the parents also. And she was so amazed and she was so thankful that she can't even tell that in the words that, and she was just crying and crying. And when I think of when I came back and when I work in the wards, when I get tired, when I get so much mental stress, I think of, when we think of a motivation, what you want. Those 15 and 17 days that we have worked there, that is just enough for the motivation and nothing else. As we see, there are so many world leaders working in their own country, and they have been incapable of serving so many healthcare facilities to their people. And our Swami is working in India as well, and so many other countries, to give this healthcare facilities free of cost, with the international standards, with love and the passion, and most importantly, compassion. So we, together as a group, PGs, every one of us from different departments, we have learned so many things in while working there. Dr. Aishwarya from anesthesia, she did her first pediatric intubation as well. Dr. Sheelu, who spoke before me, she learned about the 2D echo of small children. And when we were working in step down ICU and ICU, we learned a lot of things about the patient care. So there were so many fine evenings in the Fiji. I can talk about it whole day, but I want to specifically mention, for the first time when we went to Fiji and we met Swami for the first time in Fiji, on the satsang day, we got an opportunity to click a nice picture with Swami, and the sunset was so beautiful that it was itself showing how divine was that evening. And and when the second evening, when it was a special day on the second anniversary of the Sai Sanjeevani Children's Hospital, we got an opportunity to meet the Prime Minister of Fiji, and we all the PGs with Swami and him, we got a photograph together. And the next day, when we saw the headlines of Fiji newspaper, we all were there on the headlines. Whoever thought of that? This is all 6 months back, when I was working, when I was struggling to get a PG seat, and 6 months after that, having this opportunity, this is just something unbelievable, and that is just because of the Swami. I'm really thankful for you, Swami. At last, when the Talanova night was there, Talanova means the meaningful conversation in Fijian language. When Swami was guiding every one of us, all around the world was listening to him about his mission, about his vision towards the people of the world, and how we should lead the life. But I can assure you, Swami, now I have actually realized what actually your vision is about. It is just about self transforming ourselves, self realizing ourselves. And with your grace and blessing, Swami, I aim to walk on the path that you have set in front of me. I promise you that. At last, I have wrote few lines in Hindi for you, Swami. We call it shairi in Hindi. So, may I? यहाँ आने से पहले यहाँ आने से पहले कुछ भटका हुआ था मैं। यहाँ आने से पहले कुछ भटका हुआ था मैं। बेवजह किसी चीज़ से तन्हा था मैं। बेवजह किसी चीज़ से तन्हा था मैं। यहाँ आके आपसे मुलाकात हुई। यहाँ आके आपसे मुलाकात हुई, जैसे मंदिर में पहली इबादत हुई। वादा करता हूँ वादा करता हूँ आपसे, कभी शिकायत का मौका नहीं दूंगा। वादा करता हूँ आपसे, कभी शिकायत का मौका नहीं दूंगा। इस खूबसूरत कहानी का एक छोटा सा हिस्सा मैं भी लिखूंगा। मैं भी लिखूंगा।